Okay, so today's topic will be sexually transmitted diseases, STIs, and prevention. We are College of Nursing students at UIC.
The learning objectives, at the end of this presentation, the learner will be able to understand the importance of identifying sexually transmitted infections and identifying 3 ways to prevent them. The learner will be able to list 2 reasons why it's important for partners to get treatment, and the learner will be able to identify 3 long-term effects of untreated sexual transmitted infections.
Okay, so some pre-survey questions would be, what are STIs and how are they transmitted? What are some signs or symptoms of STIs? How can you prevent STIs? What are some long-term effects of an untreated STI? And are there treatments and would your partner need treatment? And right here is the pre-survey quiz form. There's a QR code for you to scan on your phone, and it'll give you an electronic version of the pre-survey questions. If not, you can also follow the link listed above.
So sexually transmitted infections, also known as STIs, are one of the rising infections in our world, especially in the age group of 18 to 35. The most common STI is the human papillomavirus, HPV. STIs can be transmitted through sexual contact, like vaginal, anal, and oral sex. And some STIs include syphilis, gonorrhea, chlamydia, trichomoniasis, hepatitis B, herpes simplex virus, HIV, and HPV.
So syphilis is a treatable STI and can develop into 3 stages if not treated promptly. The transmission is through direct contact with syphilis sores during sex. This can spread from mother to their unborn child. Syphilis testing at least once during pregnancy is recommended. This is diagnosed with a blood test or by taking fluid from a sore for testing. Treatment for this is injection of antibiotic benzathine, penicillin G. Partners need treatment.
Gonorrhea is a treatable STI which spreads through oral, vaginal, anal, or penile contact. It can be spread from mother to baby during birth and can also cause a serious eye infection. Even with successful treatment, you can still get reinfected if sexual contact with a gonorrhea-infected partner. And if left untreated, this can spread to the blood and cause another infection or complication. It can be diagnosed with the urine test through urethral for men or endocervical or vaginal for women using their specimens. And treatment involves an intramuscular antibiotic injection of ceftriaxone or azithromycin if there's a penicillin allergy.
Gonorrhea, some signs and symptoms for men include symptoms appear 3 to 10 days after exposure, painful urination, urethral discharge with pus. Untreated can cause a narrowing of the urethra and infertility. Some signs and symptoms for women include symptoms within 10 days. 50% are asymptomatic, may have vaginal discharge with pus, bleeding, painful urination, easily irritated vaginal tissue, discharge from glands, pain or bleeding after sex. If untreated, can cause pelvic inflammatory disease, fever, chills, nausea, vomiting, abdominal pain, and infertility. Partners need to be treated. And right here is just an infographic and a picture of the symptoms that you may experience with gonorrhea. So it shows the unusual vaginal discharge, pain during sexual intercourse, bleeding in between your periods, or pain or burning sensation when you urinate.
So chlamydia is another commonly treatable STI. The leading cause is preventable infertility and ectopic pregnancies, pregnancy outside of the uterus. It can cause permanent damage to the a woman's reproductive system, making it difficult or impossible to get pregnant. It can be transmitted to the baby during birth. Gay, bisexual men, and people with multiple sexual partners are at a higher risk. And this can be diagnosed with a laboratory test or a urine test or a vaginal swab. And if left untreated, this can cause infertility, long-term pelvic pain, ectopic pregnancy, and increased risk of getting or giving HIV.
Chlamydia continued. Some symptoms in women would be abnormal vaginal discharge, burning sensation when urinating, frequent painful, difficult urination, and can cause bleeding after sex. Symptoms in men would be discharge from penis, burning sensation when urinating, pain or swelling in one or both testicles, proctitis, which is rectal bleeding, mucus discharge or diarrhea. Treatment would be antibiotics, azithromycin, or doxycycline. You would want to avoid intercourse for 14 days, and partners need treatment. And right here is showing the difference between the symptoms that a man would experience or a woman would experience if they had chlamydia.
So trichomoniasis is an STI caused by a protozoan parasite. It can be transmitted from the vagina to penis or vice versa, also through the mouth, hands, or anus. If untreated, this can last for months or years. Some signs and symptoms in men include itching irritation inside of the penis, burning sensation after ejaculation, or discharge from the penis. And for women, they may experience discomfort during urination, itchiness, redness, and soreness of the genitals. The discharge might be a clear yellow or greenish color with a fishy odor.
Some long-term effects would be pregnant women would have premature childbirths, decreased birth weight. It can also increase the risk of getting HIV due to inflammation. The treatment for this would be antibiotics, metronidazole, usually taken twice a day for 5 to 7 days to treat infection. Partners need treatment as well. Avoid sex until partners or partner have completed treatment and get tested again due to risk of reinfection within 3 months of or after treatment.
Hepatitis B is an infection that affects the liver. It can spread through the blood, semen, and bodily fluids, so transmitted through sexual contact, pregnancy, or during your delivery of a fetus. Some signs and symptoms, there might be some clay-colored poop, jaundice, which is yellowing of the skin or eyes, fatigue, nausea, abdominal pain, joint pain, and a dark pea color. Long-term effects of hepatitis include liver death, liver failure, cancer of the liver, and death. Treatment. So currently there is no cure for hepatitis B, but it's recommended to prioritize your liver health by maintaining a healthy diet, physical activity, and avoiding alcohol.
Herpes simplex virus. So there's two, HSV1, which is oral herpes, and HSV2, which is genital herpes. This is transmitted through vaginal, anal, or oral sex. Some signs and symptoms include flu-like symptoms such as a fever, body ache, blisters around the mouth or genital areas that become swollen and painful. Some long-term effects would be a rare but serious complication, which is aseptic meningitis, which is inflammation of the brain lining. Some long-term effects on pregnancy would be miscarriages, premature births, or it could spread to the fetus during delivery. Treatment, currently there's no cure, but the treatment is antiviral medication for outbreaks. It is important that your partner has knowledge due to this being a chronic disease, and this is information you would like to disclose to your partner in the case that you are infected. And right here shows pictures of what the herpes sores would look like in the genital area, around the mouth, or from mother to baby.
Human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system. Signs and symptoms include flu-like symptoms the first 2 to 4 weeks of infection, which can look like a fever, night sweats, muscle aches, and chills. And there are 3 stages of HIV infection. The first being acute HIV infection, so it's highly contagious and you can experience the flu-like symptoms. Stage 2, the chronic HIV infection. There may be no symptoms, but the HIV can still be transmitted. And stage 3, AIDS, where it is extremely contagious and the patient is left immunosuppressed and prone to infections. The survival rate of AIDS is typically 3 years.
HIV continued long-term effects. If HIV is not treated promptly, the development of AIDS will develop rapidly. The treatment, currently there's no cure for HIV. There's an antiretroviral therapy that is used to treat HIV. It usually takes up to 6 months to control HIV. Partner safety is important because HIV can cause such life-altering side effects. It is important that you avoid sex to prevent your partner from catching HIV. Right here is a picture to show HIV partner safety. So the use of condoms, the use of PrEP for HIV negative partners, not partaking in high risk sexual activities, and treatment and prevention is important. So taking those preventative measures and taking medication and taking the treatment serious is important for partner safety.
Human papillomavirus, HPV, is usually a common STI that can be harmless or cause genital warts, which are like small bumps and possibly lead to cancer. This spreads through sexual skin-to-skin contact, and the signs and symptoms are usually the genital warts. Long-term effects, so it can lead to cancer of the vagina, vulva, penis, anus, mouth, or throat. There's currently no cure for HPV, and preventative measures can include HPV vaccines.
So risk factors and prevention. Some risk factors would be having a history of STIs, engaging in sexual intercourse without the use of a condom, having multiple sexual partners, or engaging in sexual activity under the influence of alcohol and drugs, due to the fact that it distorts individuals' inhibition in decision-making, which can lead to risky behaviors, such as using no protection. Some prevention would be use of contraceptives, for example, condoms, abstinence, vaccinations. Recommended age for HPV vaccination are between the ages of 11 to 26. Over the age of 26 poses potential risk for new infections and loses its benefits. Discuss this with your doctor if this is a possible consideration for you. Reducing the number of sexual partners also is a preventative measure, lowering the risk of STIs. Important to test with your partner and to share results with each other.
So the treatments can vary depending on the STI that's been diagnosed. And again, syphilis, gonorrhea, chlamydia, and trichomoniasis can be treated, while hepatitis B, HIV, HSV, and HPV do not have a cure. And once you are treated, it does not mean that you're immune, as you can still contract the disease. And you can diagnose this through getting some physical examinations, a blood test, urinalysis, or some swab cultures.
Some key takeaways is removing the stigma associated with STIs allows one to fully accept oneself. Early identification is important to prevent complications for oneself and to your partner. 3 ways to prevent STIs include vaccination, such as the HPV vaccine, use of contraceptives, for example, condoms, and reducing the number of sex partners. 2 reasons it is important for your partner to get treatment is to prevent the spread of STIs and to receive proper treatment for both parties. Health complications can occur if not treating STIs appropriately or at all. Possible causes, if prolonging treatment, include inflammatory diseases, infertility, ectopic pregnancies, cervical cancer, congenital infections transmitted from mother to baby. Some STIs require partner treatment, while other STIs can be treated, not cured.
So these are post-survey questions, which are the same as the pre-survey questions. The what are STIs and how are they transmitted? What are some signs and symptoms? How can you prevent STIs? What are some long-term effects of an untreated STI? And are there treatments, and would your partner need treatment? And here's just another QR code where you can scan and go to the same questionnaire to measure or compare your newly learned knowledge from before the presentation.
Question 1 is, what are STIs and how are they transmitted? The answer to question 1 is STIs are sexually transmitted infections and are transmitted through sexual contact, including vaginal, anal, and oral sex.
Question 2, what are some common signs and symptoms of STIs? So the answer would be some skin rashes, flu-like symptoms like fever, chills, pain or burning with urination, abdominal pain, etc.
Question 3 would be, how can you prevent STIs? The answer to that is use of contraceptives such as condoms, abstinence, vaccinations such as the HPV vaccine, limiting the number of sex partners you have, and getting checked regularly for STIs.
Question 4, what are some long-term effects of an untreated STI? So you can get neurosyphilis from syphilis, disseminated gonococcal infection from gonorrhea, decreased fertility from chlamydia and or gonorrhea, pelvic inflammatory disease from chlamydia and or gonorrhea, AIDS, which can develop rapidly from untreated HIV, several types of cancer like cervical, oral, vaginal from untreated HPV, and congenital infections.
Question 5 would be, are there treatments And would your partner need treatment? The answer to question 5 is syphilis, gonorrhea, chlamydia, and trichomoniasis have treatment, and all require partners to be treated as well. Hepatitis B, HSV, HIV, and HPV currently have no treatments. Recommended to use preventative methods like HPV vaccine and maintain a healthy lifestyle, regular exercise, healthy diet, and avoid alcohol.
So UIH 55th and Pulaski Health Collaborative is the partner facility that we worked with to develop this presentation. Their clinic hours are Monday to Friday, 8 a.m. to 5 p.m. Appointments are required, so you need to call the number as stated. They also have an immediate care available on the first level, along with a variety of specialties on their other levels. And that one, the immediate care has no appointment required. And the address is 5525 South Pulaski Road, Chicago, Illinois, 60629. And more information can be found at 55th.uihealth.care. And this is the audience evaluation form. So if you could just use the QR code and provide any feedback and let us know how we did on the presentation and how we can improve.
Right here are the resources listed that we used to create this presentation. We got most of our information from the CDC, the U.S. Department of Health and Human Services, and the WHO.
So thank you for your time watching the presentation, and we hope you learn more about STIs and prevention.